of all patients.
In the first study,
I
we observed
that
that
we
some
now
deficiencies
are
in
in
the
an era.
Talking about the care around PKU in the whole of Europe, are there still many differences between West and East or North and South?
Well, these differences for sure exist, and that was the subject of one of the publications that was just published in 2015 in European Journal of Pediatrics. This was a publication where a group of scientists from many countries in Europe were performing multi-center studies, asking scientists and doctors who are taking care about PKU patients from 19 countries. There were about 37 centers that we sent a special questionnaire, and these were countries mainly from East and South part of Europe. In this questionnaire, we asked numbers of questions dedicated to the screening procedures, to the diagnosis, to the time when the treatment was introduced, how is the treatment, if there is a idea of lifelong treatment, and generally we were asking about the standard of care which is offered to PKU patients in this part of Europe. And we were really surprised finding significant differences existing between the countries. Starting from the screening, it's hard to believe that in 21st centuries there are still countries in Europe where screening is really not introduced yet. Maybe it will be introduced very soon. There are at least in 2013 there were 5 countries where the screening was not running. Then there were still some countries which introduced the screening just recently, so we calculated that there may be still several children, 15, maybe 20 every year, born in these countries and being not screened, being not early diagnosed. Then the other differences were based on the treatment team. So there are some centers where the dietitian are not available and are not giving the service to the patients. So generally, yes, these differences still exist, and we hope that in the near future, also based on the development which was just completed of European PKU guidelines, these differences will be at least smaller. They will probably still exist for some more years, but maybe we can do something to make them smaller, because I strongly believe that all patients with PKU born in Europe should receive equally high standard of treatment.
So, what to do now? How to act with this new knowledge?
Well, first of all, education. And it is not only a matter of education of patients, but also education of doctors and all professionals involved in the care of PKU patients. This is one thing. Then we are very proud that we just completed to develop this European PKU guidelines, which was initiated by ESPKU. And we hope that sharing these guidelines and the recommendations and suggestions, treatment and diagnostic suggestions included in these guidelines, we will be enriching all professionals in Europe with this recommendation. We will be able to decrease these differences which still exist.
Yeah, well, from this study, we all know now that there are many children walking around with this serious disease. How to act with that knowledge?
Well, we just have to reach these children, and we have to focus our attention and all our efforts to give them the best service, best treatment, and this is available, but it requires a lot of efforts and energy, of course.
Yeah, I can imagine that it's also not very simple to find all these patients.
Well, with the newborn screening program, at least to reach the newly diagnosed shouldn't be so difficult. But of course, we have to realize that among our PKU patients, there are still persons who were born before the era of screening. So they are so-called late or undiagnosed PKU patients. Late diagnosed means generally that they were diagnosed after the 3rd month of age, but before 6-7 years of age. And the undiagnosed are those who were diagnosed or never been diagnosed later on. We strongly believe that at least for the children up to the age of 6-7 years who were diagnosed in this particular period of time, introduction, even late introduction of treatment should be always considered, because late introduction of treatment in these young children can significantly improve their existence and can significantly improve their IQ. So there is no doubt about this, that in all late diagnosed children, the late introduction of treatment should be considered. Regarding the adults or older people who were not diagnosed before, this is something which should be very individualized, and all individual situations should be analyzed in details. But indeed, even in undiagnosed in adults with PKU, late introduction of treatment can significantly change the quality of life of these patients. It will work not in all patients, probably in half of them, and at the beginning of such a treatment, it is almost impossible to predict who will respond to this late treatment intervention. But many of these patients may improve in the form of behavior. They may become less aggressive. They may have less intensive epileptic attack. So they can really improve in the different domains. It makes their lives and their family lives easier, but once again, it's hard to say who will respond. And there is a rule that they respond very individually, so some people may show the beneficial effects already after several weeks, while the others will need at least several months. And there is a recommendation to judge the effectiveness of this treatment not earlier than before the 6 months of such a kind of treatment.
So what's the biggest challenge when we're talking about these issues for you?
For me, regarding late and undiagnosed patients is to find them, and then in younger children, always to try even late introduction of treatment, and in adults to consider individually, to educate the families or caregivers that this kind of therapeutic option exists, but it is not easy. It is not easy to introduce this kind of treatment for this very particular group of patients.
I can imagine. Thank you so much.
You are welcome.